So tell me how it started. If you've got pain, what happened? Did you hurt yourself, or did you just get pain? Did it something that just kind of started? That's really important to know, because when we have a problem where you've had a trauma, so you've had a car crash, you've fallen over, you've picked something up, you're going to have a series of events that occur. So your body will go into repair inflammation stage, which is basically your healing process. You've had something that's hurt you, your body goes into injury mode, and you get pain, you get swelling, you get a definite trauma or incidents that you can pinpoint and label. And in terms of that, the sequence of healing is quite different. So you have your inflammatory stage, you have the body trying to repair stage, and you have the body trying to strengthen and get back to normal stage. And a lot of us know, we rolled our ankle, we hurt our back, oh my God, I can't move, it's hurt. So we look after it for a couple of days, and then we can start moving, because that's the inflammatory stage. It's then healing, and depending on how severely you've damaged it. So when we roll our ankle, it's sort of a little bit of a tweak, it's okay. You kind of 3 weeks. If you kind of roll it a little bit more, it's maybe 6 weeks. And then if you've kind of done like a decent roll, it's a decent amount of damage, you're maybe looking at the 3 months. So that is the normal cycle of healing. And the same goes for back pain. If we have a back pain injury, it's normally a cycle of healing of about 3 months. And that's why most people will say your cycle of healing is 3 months. Once you've kind of gone past that cycle of healing of 3 months, and most back pain can be self-limiting, it kind of get back to normal. When you have either done nothing with that back pain, so you've kind of been scared to move, and you then try and move after 3 months, you've kind of had 3 months where the body hasn't moved at all, so some changes take place. You get stiffer, you lose flexibility, you've lost muscle strength, your kind of core and posture muscles take over, or reduce down, and all your big muscles take over, and then you kind of get that spasm effect. And the whole cycle is a little bit different, because you've spent 2 or 3 months not doing your normal activities. You've been in protection mode because you're scared to move. Now that then carries on and through, and your acute stage of pain, so that acute stage of pain and problem isn't there anymore, but some of the symptoms of that, like the pain and the difficulty of moving and the weakness and the imbalance and the stiffness, remain. And that is that one. That's what then takes your problem that little bit further on. So we kind of need to address that very early on. If you have pain, or you've hurt yourself, or you've had trauma, get it seen to early, so that we maximize the body's potential for healing, and then you get back to your normal self very quickly, because you've kind of maximized all this. The body's natural process is helping you. So that's kind of when you have that trauma stage. Now when you have, I don't know what happened, it's just started getting sore, I'm not really sure what's going on, it's just getting a bit of a niggle, and then over time that niggle has got worse, or that niggle is now problematic. That's a different cycle, that's a different kind of problem. So that's more like your repetitive strain kind of problem, your kind of postural issues, your kind of, something's going on biomechanically, or something's been going on that's maybe causing stress and strain. And that can be a number of different things. It can be that, you've changed your shoes, you've changed how you work, you've changed your activity, you've changed your training, you maybe have a little bit of a funny way that you sit, or that, you're working in one way, and that has caused some kind of stress and strain throughout the body. And that is something that shows progressively, or that is something that shows over time, until one day you're like, I'm so sore and I don't know what to do about it. And you don't know what to do about it because you don't know what's caused it. And this is where it gets a little bit harder to manage, because you're not getting that definitive, I hurt myself, I fell over, I know I did this, so it's okay. And you've got something to deal with. When you've kind of got this, it came out of nowhere and it's getting worse, you probably need a little bit of help. Sometimes it's just a bit of weakness. Sometimes we just have, some muscles have got tight, especially if you're kind of an office worker, you spend a lot of the time sitting, or your job is very kind of repetitive in one way. You might find that's just how things have happened, and it's very easy to change that. If it's not, and if it's been something that needs and it's carrying on, you probably do need a little bit of help in trying to address it, because there might be things that you're not aware of. And that is definitely what I see in a lot of my clients, is that I'm pointing out things that are so obvious to me, but very, very, you brush over them because you're not looking for it. Like the same whenever I see a hairdresser and somebody, I'm a hairdresser, you think, oh my God, I should have done my grey, oh my God, my hair's a mess, and what do they think of me? Or, you see somebody says they're a dentist and you're kind of like very conscious of your teeth. It's one of those kind of progressive things where you then need to be aware of what you need to do. So when I'm looking at you as a physio, most people kind of go, oh, I need to sit better, or, as soon as you walk in, you're going to sit better, you're going to sit up straighter, you're kind of going to hold yourself a little bit differently because you're aware somebody's looking at you and looking at your body. It doesn't hide your little tweaks, because we can see how you move, we can see what your kind of inconsistencies or your patterns, and in jargon kind of jargon time, it is called like postural dysfunction, or it is called your movement patterns or faulty movement patterns. And what it basically means is it's your daily habits and how you hold yourself and how you move now cause you a problem, and how you sit now causes you a problem, or how you walk now causes you a problem. Now that's just your habit. It can be that you're sitting in a poor chair and it's kind of now making you sore, or you're wearing shoes that are kind of making you sore, or the thing in the skill factor is finding out what is your problem coming from. And if you are addressing this feels weak, or this feels tight, or this feels a little inflexible, and it keeps coming back, guaranteed you're not addressing why it's happening. And that is kind of a key. So 2 different styles of problems. Second, like the latter one, can ring true for the first one. So if you've got that acute trauma, you get it managed, you get your injury, you kind of manage what's going on and move on, it's likely that that's the end of it. If you've had that acute trauma and you don't, and you kind of protect yourself, you might find that that keeps coming back, and that then leads into that kind of postural dysfunction, where that posture and that habit, or what you do day to day, or the lack of strength, flexibility, an area being stiff, is causing all these knock-on problems that then are kind of your faulty movement patterns. And it's basically can be really simple. It can be so simple, it's unbelievable. I have had clients come in saying, I've had this pain for years and I can't fix it, I can't shift it, I can't do anything. It gets better and then the next day it's back, it gets better and then the next day it's back. And it is something so simple that when they're standing up, they're kind of leaning backwards because they're in sway. So when they kind of get their posture correct and it's here, there's no pressure on their back, but when they go into sway, it pinches. So all I'm doing is correcting that, correcting the fact that they just need to bring their posture a little bit, or their weight in their feet slightly backwards, and correct their posture on top, and hey presto, they're pain free. And that's just because we don't sit and hold our fingers back all day because it hurts, yet we do that to our spines all day. So something very simple can be life-changing. So what should you expect when you see your physio, or what should you expect when you see your health professional? You need to let us know what's gone on with you, what your history is, and we all ask that, and then we're all looking at what's going on. But then we need to tie in what you're telling us to meet how you are now and where you want to be, and what it's going to take for us to get there. And sometimes the answer is so simple like that. Like I say, I've had people that have been in pain, have gone to pain free within 2 days, because they're kind of trying to do that on a day-to-day basis, and their pain can stay better. And then all the work for them is to remember to do that and readjust posture so that they stay better. Sometimes it's stiffness and we need to stretch you, sometimes it's muscle strengthening and you need to strengthen, sometimes it is, that you don't realize what you're doing and how you're holding yourself, and you need to change that. Let me know what you think. If you have a problem and it is acute and you've had a trauma, get it seen straight away so you maximize your healing potential. We all do the same thing. We all go, oh, I'll see how it goes for a day or two. I'll see how it feels in a week. If it's not settling and it's not improving and it's not changing, definitely get it looked at within the first 3 weeks if you can. You know, that's kind of your getting into subacute section, because it might just be some advice that keeps you on the right track. If you have problems that are continually and getting worse and you're not getting the right answers with what you're doing, go ask somebody that can, because you might find something as simple as sitting with a pillow behind your back, you know, sitting down a bit differently, standing a little bit differently, being aware of things a little bit differently is all it takes to make your life 100% better. Let me know what you think. And if you're with a health professional that isn't answering your questions, find another one who will.